My name is Claire and I'm 57 and I'm a southeast Londoner, very important.
Hi everyone, my name is Didem Ergin. Currently, I am in Turkey because of my treatment has ended about 10 months ago.
It's Tony, and I live in Leicester with my wife. So the last 10 years I've been retired.
Okay.
In actual fact, I'd had a mammogram about a year before I had my diagnosis, and I didn't have any specific kind of signs per se, i.e. lumps and things, but I had a few little areas that were a bit sort of tender, almost like a bruise. And if I'm really, really honest, I didn't probably go as soon as I should have done. But when I did actually go, everything happened very, very quickly. Obviously, you go in on this 2-week pathway. I was seen at the hospital. That first visit to the hospital, having been examined by the surgeon and then sent down to have scans, and obviously I had quite a few biopsies, I realised at that point that obviously there was a problem and things weren't looking great, and that was absolutely terrifying, and I was, beside myself. Went back a week later, was given the diagnosis, so I had stage 1 ductal carcinoma, and there were actually, when they'd done the histology, there were actually 7 areas of cancer, and it had spread into my lymph nodes as well. It kind of really happens so quickly. You get this diagnosis and then you're presented with all these different choices of, these are the options. You know, I was told that I'd need a mastectomy, and then there were discussions around, would I have a reconstruction? Would I not? What kind of reconstruction would it be? And lots of medical jargon. And it was like being thrust into a world where everyone's speaking a completely foreign language and asking you to make decisions about something you're just not really understanding. Within a month, I went in to have a mastectomy, and I had an immediate reconstruction, for a DIEP flap reconstruction from my stomach. So a month later, I went in and had 21 lymph nodes removed. So I did chemotherapy, 4 cycles, and then after the chemo, I was in pieces and felt dreadfully ill and awful. Had a little bit of a break, about 6 weeks, and then went and had 15 sessions of radiotherapy.
My experience about the breast cancer started in the US about exactly a year ago. I got a diagnosis and it was very unexpected. I guess nobody expects cancer coming up, right? I was breastfeeding my son. I gave birth in September 2021. And then I breastfed my son about 6 months, and it was not possible for me, of course, to notice any bumps in my breast while I was nursing. And right after I quit nursing around May, this was the time I started exercising and like trying to get through the postpartum syndrome, as you all know. And I had some blood coming in my breast, and I kept delaying it, thinking, oh, it's because I no longer nursed. However, my husband was very persistent to go. So we went to the doctors, and the doctor was like, it doesn't look like anything, but let me just take samples so we know that we are sure 100% it's not nothing. And about a week later, on a Friday evening, he called me. And these things always happen on Friday evenings, right? I'm very sorry, but it looks like you have tumor issues, like cancer tissues in your breast. About 3 weeks later, we flew to Turkey because we wanted to be with our family and get the support we needed. Yeah, I immediately was in the surgery, so my entire right breast was taken out. They said the tumor was quite large, actually, and they didn't want to risk it. And I'm 36 right now. For them, this is a quite early age to get a cancer diagnosis, so they didn't want to risk it. So I was also treated with chemotherapy and then radiation after. My treatment was over about 6 months ago.
It all started. We were on we went on a safari holiday in Namibia, and we were bouncing around in a Land Rover for 2 weeks, and I felt a soreness on my right nipple, but I just put it down to the seatbelt just rubbing on my chest. But when I got home, it persisted, and then probably a couple of months later, I felt a lump there. But I hadn't told my wife anything, because I still didn't tell her. And the lump got bigger, and 5 months later, it just after Christmas in 2011, and we were sitting on the settee, and she sort of hit me across the chest for some obscure reason, and she felt the lump and sort of insisted that I went down to the GP and get him to have a look at it. And he didn't think it was anything serious. He thought it's probably a cyst, but he sent me to the breast unit. First lady I saw, I could tell that there was something seriously wrong even before she just examined me before she'd done any scans or anything. I could tell there was something not right about it. So subsequently, I was diagnosed with breast cancer. So I had a mastectomy, and then I had chemotherapy. That was probably the worst time of my treatment, going through chemo. But after that, I then had a lymphodectomy, and initially there were some lymph nodes affected, but on the clearance they found no more. So that was great news. And then I had radiotherapy, and then tamoxifen. I was on tamoxifen for 10 years, and I finished that last October.
There just weren't any highs. I found the whole process was terrifying and grueling. It was 10 months of very, very full-on treatment, and it was a hideous hideous roller coaster ride, and very, very, very challenging. If I was really honest, there were times where I used to go to sleep at night and I used to think, do you know what, I don't want to wake up in the morning, because I just don't want to do any more of this. I don't want to go back for more chemo. I don't want to go and have more radiotherapy. And I'm a big baby, and I'm terrified of medical operations, even just blood tests. So it was a big deal, and I'm sure it is for a lot of people. I think we're all very aware that the potential treatment that you're going to go through is going to be very, very grueling. And I think at the point of diagnosis, when you know that this is going to happen, I think that's where an awful lot of the fear comes in.
First of all, of course, receiving that diagnosis and accepting the fact that I have a tumor in my breast was a big, like a shocking experience for me. Just coming to conclusion of, it's not just getting the call and hearing doctors saying, "Oh, you have it." Yeah. It's not that. After that, like literally just being with my body and like mentally trying to like accept, okay, I'm going through this whole period of treatment and it's not going to be easy. My tendency, at least, is just like trying to do everything on my own. My first reaction to my husband was like, "Oh, we should get this done in the US and don't tell our family." And he was like, "What are you? This is a crazy idea. They will know it and they will help us to go through this period." Like the doctor called me, said, "You have stage 2, you have cancer, but you need to come the next day. We need to do more testing to see what stage it is." When we hung up the phone with him, with my husband, we had 48 hours ahead of us, just empty and not knowing what stage is the cancer. So that was a huge unknown to work with. Difficult. And that was I guess I can say, the lowest parts of the whole experience was dealing with the unknown. They put me into menopause. So that was not easy for me. Accepting the fact that I may not have another child, because I'm towards the end of my fertility anyways, and I need to be in this tamoxifen and other hormonal drugs for at least 5 years, I heard. So coming into accepting like that feeling of grief in terms of he might be my only child.
So I had a mastectomy, which was not really a problem, to be honest. And then I had chemotherapy, which was a problem. That was probably the worst time of my treatment, going through chemo. Problems with the lymph nodes and whatnot, and they were all clear. I think that's probably the high. But I mean, I've also got to say that the treatment I had was exemplary. You know, it was absolutely fantastic. There's some disadvantages of being a man, in as much as you're on your own. You've got no other men to talk to. I met another man about 3 years after, when I did the breast cancer care show, the fashion show. But then until we formed this VMU 18 months ago, I really hadn't talked to any other man about it. So there's a feeling of isolation.
I think the importance is, in terms of nursing, is really feeling the need to be heard. It's having a conversation with someone who is actually acknowledging who you are as a person, and is okay with allowing you to sit there and say, I'm absolutely terrified. Really does come down to communication, I think, for me, and being seen as a person rather than a patient. So it was the fear of that word in itself is enough to just strike terror into the average person.
I still vividly remember her face, actually. When I went to chemotherapy first time, I was very scared, as all patients would be. And I sat on the chair, and like, I didn't know what's coming up. I had no idea. Like, she had a calm energy, this woman, this nurse, and she approached to me, and I said, I'm very scared, actually. I don't know what's coming up. And what's so nice about her way of answering was, it was not so much of like, oh, well, this is gonna pass. She was very like, she had this spaciousness in her energy, and she was like, I know this is difficult. Like, I see it every day. All of you, like, different treatments come here. I know this is very difficult. I'm here for you. Like, she held my hand, and she was very warm. Hearing that validation of how I feel, and how scary this can be, and reminding me my like resilience in this scenario, it was very helpful to hear from somebody else, because sometimes even though we know we work with ourselves, we still need to hear it from others, right? How we are not alone.
When I was finally diagnosed properly, and I came out of the consultant's room, and the nurse took my wife and myself to a side room. They sat us down on some comfortable chairs and brought us a cup of tea. And gave away some leaflets, but then she left us alone to basically to come to terms with it ourselves, which I thought was really good. And also, I've got to say that when they got to know me, when I was going through the treatment, I felt like at the time there was, I don't know whether you're into football, but there was a man called Jose Mourinho who was managing Chelsea, who called himself the special one. And every time I went into the breast unit, I felt like I was a special one, to be honest. Twice early on, when we were waiting in the waiting room, the nurse would come in, and they did assume that it was my wife who was going for the treatment and not me. And that happened on at least 2 occasions. And at the time, I found that mildly annoying.
I don't want to generalise, but I would think for most people, you really are in a state of shock. And I think being able to actually take anything on board, so having, and I did have a meeting with the CNS once I'd made the decision about what kind of surgery I would have, who proceeded to try and show me photographs of other people's operations. And I just couldn't engage. Certainly the nurse that was talking to me at that time, to have read that situation better, because the more she was trying to get me to to look at things, the more I was moving backwards and actually shutting down. And I think had she been reading the situation a little bit better and perhaps just taken the drain off the desk and put the book of photos away and just said, okay, what is it that you're really scared about? What is it, you know, that you're really worried about? I think that may have prepared me better. And I understand that in terms of cancer treatment, you know, you get that diagnosis and then you're up and running. So there is an issue around how quickly that can happen. It's the need to say how you're feeling. And I think that's the little bit that kind of gets missed out. I think the nurses, I think it's just that holding someone a little bit better at the beginning and just have a little bit of breathing space and go, okay. And then I think I might have been able to hear things better.
To very much a lesser extent of radiotherapy, apart from the fact that 3 years ago I did have I had to have a double heart bypass, and because I'd had radiotherapy on that side, he didn't want to take any blood vessels off. And the other thing was about the nurses were extremely keen after I finished my treatment that I got tested for gene tested because my sister had breast cancer, and because I was a man, it was unusual. They wanted me to do it, which I did, and they found that I got the BRCA2 gene. Whilst I went for counselling, again, you don't take on board all the implications of what's going to happen. And I, in my naivety, I thought I want to do it because if I've got the gene, I can warn my children they've got the gene, and they could subsequently warn the grandchildren. But it doesn't quite work like that.
I guess nurses are a huge part of keeping this a holistic approach. For example, after my surgery, the surgeon said, you know, within few weeks, as soon as the wounds start healing, be sure to lift your arm, and like, you know, trying to like lift more and more. I tried that, and it was not easy though. Like I guess what could have been better is telling me, because I discovered this on my own. I worked with a physiotherapist and received his help in terms of opening up that fascia and, like, you know, being able to lift my arm up. I wish my doctors or others told me, like, advise me in those things. Those were the things that I discovered on my own, and that could have been a way of adding to the holistic approach.